It's an unintended consequence of the opioid crisis. Patients looking for organs are getting them quicker from those who have overdosed on drugs. I'm Carly Robinson at the University of Alberta Hospital, where earlier today I spoke with one doctor about what exactly is happening across the province. The numbers are startling. In 2017, 25% of organ donors died as a result of drug overdose, a steady increase from 10% in 2015.
We have noticed an increase in the last 2 years. They still make up a minority of our donors.
Dr. Coetzee hopes these numbers are just a blip, and that through education and public health policies such as safe injection sites, the numbers of overdose deaths go down.
And a lot of these individuals are quite young.
Dr. Maruyama started this card game to fight drug overdoses. She would prefer if there were fewer victims.
Although we're very thankful to the families of all these young donors, to give the gift of life and to donate the organs, it is still a very traumatic thing to see.
Now, in order to be an organ donor, you have to have been at the ICU unit of a hospital, and all life-saving measures have to be exhausted. Now, for drug overdose victims, normally what happens is your body goes into cardiac arrest. And although you may have been resuscitated at the hospital, the lack of oxygen to the brain was just too much. And that's when the conversation starts about organ donation.
And then there's certain criteria in Canada where we have to wait to see whether their brain is damaged enough from lack of blood supply for that period of time when they had the cardiac arrest before we can say that they have no possibility of recovering brain function.
That's when the conversation happens with the donor's family. Now, all organs are intensely screened for possible illness, and AHS says the majority of these overdoses come from oral consumption. But when it is an intravenous drug user, the person getting the transplant is warned of a high-risk donor.
Has a detailed discussion with recipients about the potential risks. Based on our investigations and methods that we screen, the risk is very low. It's well under 1%.
But doctors hope for fewer of these conversations as more is done to tackle the opioid crisis.
It's not our emphasis in the donation world. We just happen to be involved in it because some of these patients do meet criteria for organ donation.
In recent years, Canada has actually seen an increase in donors unrelated to overdose deaths. And doctors credit this to more awareness campaigns, as well as more people talking to their loved ones about their wishes surrounding organ donations. In Edmonton, Carly Robinson, City News.